and welcome to episode 2 of Evil Personified, the murder of Dr. Thomas Burchard. My name is Judy Earp. I was Dr. Burchard's fiancé. We'd known each other, been together for about 17 years. And I feel that I'm probably the most qualified to answer so many of the unanswered questions regarding Tom's murder. And I will most likely be referring to him as Tom rather than Dr. Burchard because that's just what comes natural. It's what I always called him. So bear with me. This is very difficult emotionally, and sometimes there's a little bit of time between episode 1 and 2, or there has been 3 weeks, and I really apologize for that, but it was just very difficult emotionally. Literally reliving that horrendous time in my life. This is also no budget, not just low budget, no budget. I do all the editing. I have done everything myself. There's been many, media stories and of all different types. None of them have been 100% accurate. There's been a lot of supposition and a lot of questions people have that have remained unanswered. And I intend to answer those questions from my perspective, from what I knew at the time, and sometimes what I know now. This is all from my perspective. And I don't think anyone knew Tom as well as I did, especially the last few years. So bear with me and let's continue our journey. And also, if you have any questions you would like to see addressed, please put them in the comments and I will address them at the proper time. One of the questions and also errors that I have noticed in many of the media reports and discrepancies: was Tom a psychiatrist or was he a psychologist? And what is the difference between the two, and what difference does that make in this case? Tom was a psychiatrist. A psychiatrist is a medical doctor. They go through medical school, residency, and all, the other education and licensing requirements that any medical doctor goes through. They're a medical doctor, and psychiatry happens to be their chosen field that they will specialize in. Just like, you have surgeons or pediatricians, it's his chosen field. It was his chosen field, and particularly child psychiatry. Now, in addition to, Tom is a medical doctor, which means that he could write prescriptions. And he was also specially licensed to write prescriptions that are very highly regulated, psychiatric drugs and very abusable drugs. And that is what made him even more valuable to Kelsey Turner and her cohorts. Now, a psychologist, just so that we address what is the difference, a psychologist, if he's called a doctor, it's a PhD. Someone who has studied psychology and majored in psychology in, college, university, and has received a license from their state to practice as a psychologist or therapist. And not all psychologists have a PhD. That's why you'll see some referred to as a doctor and some just as a therapist or psychologist. So I hope that kind of set the record straight on that part. Another question that I am frequently asked, and I see in a lot of comments too, how did Tom ever become even associated with people like Kelsey Turner? I mean, that they usually do not move in the same social circles. Tom had a reputation, I believe I have gone over that in the previous episode, of helping people. It didn't really matter if they were a woman, man, you know. He had a soft spot for children particularly, especially if somebody was asking for help for their children. Tom's email, his work email, was public. It was printed on, or published rather, on the hospital's website, Community Hospital of the Monterey Peninsula. And she contacted him initially by email, saying that she was a victim of domestic abuse and was going to leave her husband, and she would be a single mother of two, a little girl and a little boy, and she would be homeless because her husband was in the military and they lived in military housing, and she would not be able to continue to live there. She also said that she was a successful model, which we will address in a few minutes, and but she didn't have a credit history and therefore could not qualify to sign a lease or to rent a place to go. And well, of course, you know, the children and being homeless, that honed right in on one of probably Tom's biggest soft spot, vulnerability. I mean, that's what his main purpose in life was helping particularly children. And she's very manipulative, and so she honed in on that right from the beginning. How she heard about him, I'm not exactly certain, but I do know he had a reputation. The Monterey community is still a small community. People know each other, and, you know, people talk. And I did notice later on, looking at her Facebook profile, that some of her friends were patients of the Toms. So I highly suspect that is how she heard about Tom, because he had a reputation and everybody liked him. He was everybody's friend, and being the type of person she was, she knew how to hone in and exploit that. As far as John Kennison, I will address him later on in this video, but Tom did not know him. I did not know him. Neither of us even knew of his existence. I didn't know about it until after Tom had been murdered, and someone on Facebook had mentioned that the boyfriend that everybody thought she had been replaced a few weeks prior to this by this John Kennison. But we'll address that a little bit later on in this video. And another question that is asked frequently or commented on, was she really a successful model and a successful Playboy model? Well, let's take a look at that. Particularly keep in mind the type of model that she was. This was Playboy Italia, not the American, Hugh Hefner, Playboy Bunny type of Playboy that here in the United States we immediately would come to mind on. So I think the standards were a little bit lower. She was basically a model or subject of photographs that she had little to no clothes on. Okay, so that tells you what kind of model she was. And now let's take a look at, well, maybe that's probably not quite the right word to say, the way to phrase it, but let's examine this a little bit, okay? She is over 30 now, and she was in her late 20s at this time. Now, there are a few models, like, the supermodel type, and we are absolutely not talking about a supermodel or even, a fashion model or anything like that. I mean, there are a few Christy Brinkley's that, can carry their career on past middle age even, but she is not one of them, okay? Or was not one of them. Like I said before, she posed with little to no clothes on. I think mostly with no clothes on. I haven't really looked, but anything on the internet, it's like she just has her hands in strategic places. So that kind of tells you what kind of model she was, okay? Now, her age, she was hitting 30. Models, even fashion models, age out in their early 20s, okay? So she was already pretty much, getting past her prime for that type of modeling. Age, gravity, the drugs. She was a drug user. She drank heavily, partied, probably, I don't know, but just judging from what I've heard and seen, probably 6 out of the 7 nights a week, So that takes a toll. And there's only so much Photoshop and plastic surgery, which I know she had several enhancements, shall we say, with plastic surgery. There's only so much that can do. I mean, it's not going to really extend your career much, okay, if you ever had it in the first place. When we look at the Playboy title she likes to give herself, Playboy model, and which has been repeated, by many media sources. The key word in here is Playboy Italia, okay? I'm not real up on, all these types of magazines. That's not my area of expertise. But talking with several reporters and media, people have really dug into her background. Supposedly, allegedly, or however you want to phrase it, when Playboy here in the United States was contacted to ask about this, their reply was that they had never heard of her. So, I guess it's some Italian version of Playboy. Some Italian porn magazine, I guess, okay? We'll just say it like it is, okay? Sad but true, okay? And now look at what her profession was when she was in Las Vegas. When she was at the time that she committed this murder, she was a stripper. And she was pregnant, but we'll carry that, we'll look into that a little bit later. Strippers are usually, that's kind of on the way down. It's not really sought after job, I guess, I guess that's where washed up, aged out porn models go next, is stripping. I don't know. But that just seems to be. That, you know, I've seen very frequently, or I have actually seen it even more frequently, just assumed and reported as such, even though it is completely false. Kelsey Turner was not a patient of Tom's. Kelsey Turner nor any member of her family was a patient of Tom's. I'll just put that out there right now. That did not stop Kelsey Turner from attempting to get Tom to write her prescriptions for psychiatric and anti-anxiety drugs like Xanax and other highly abusable drugs. Tom refused. He even offered to pay for her to go to another doctor to have them prescribe the medication. It would have been unethical for him to do that himself, knowing her personally. And he also knew she was drug seeking. And so she did go to another, or anyhow, she says that she went. I do have the text that this is what she said, that she did go to another doctor, and he refused to write the prescription for her for Xanax. So that tells you a lot right there. Now that brings us to John Kennison. As I stated before, I didn't know John Kennison. Tom didn't know John Kennison, and neither of us had ever heard of him. Now I'm referring, the only information I have on John Kennison is what I have seen in the media and court records and court appearances, such as at his sentencing and in his, I believe, did a couple of jailhouse interviews. In the first one of his jailhouse interviews, when he asked outright by the reporter if he and Kelsey Turner did in fact murder Tom. And his reply, and I am paraphrasing right now because honestly it is really, really difficult for me to watch this over and over again and relive it. But he said something to the effect of course not. Well, he didn't say of course not. He said, no, we are not monsters. Monsters. That was what he called or referred to anybody that did commit this heinous murder. A little while later, he pleads guilty, to second degree murder in conspiring to commit murder with Kelsey Turner. So his plea guilty pretty much said that, yeah, she was with me, even though her plea is like, oh, it was an offered plea, Well, I still didn't do it, but I realized that there's enough evidence to convict me, so there's that. So by his own admission, he calls himself and Kelsey Turner monsters. From what I understand, at the sentencing, the judge stated that they had that this beating, that torture basically, that Tom underwent lasted for several hours. They had the opportunity at any time during that to stop. And Tom had asked to be taken to the hospital. Tom, being a doctor, he knew that he wouldn't survive this beating. And that just adds to the torture. So yes, John Kennison, you and Kelsey Turner, you are monsters of the most despicable kind. Now, like I said, that I intend to attempt to get a full-length video out every week. I know it's been 3 weeks since episode 1. It's been very difficult emotionally, and also it's been difficult physically learning the editing process. So bear with me. If you have any questions that you would like addressed, please put them in the comments. And please subscribe to the channel and push the little bell to be notified when I do get those the next episodes out. And share it. Share the videos. Share. You know, I'd like to see this reach as many people as the initial reports did, that many were erroneous. And again, if you have questions, put them in the comments. And I hope to see you in the next episode, which I hope to have out within the next few days. Oh, and one question, just as a little teaser, that I will be addressing, because I've been asked lots of times, who was the baby daddy?